Hello, everyone. This recording is a review of a PowerPoint presentation provided by the Alzheimer's Association, reviewing the impacts of Alzheimer's disease and cognitive impairments on health outcomes, particularly in acute care settings. I strongly recommend students to check out the Alzheimer's Association as it has a wealth of resources for Alzheimer's disease. And also the goal of Alzheimer's Association is to eventually eliminate Alzheimer's disease through research. It also provides a lot of care and support services to families and persons affected with Alzheimer's disease. The goal is to reduce the risk of dementia through the promotion of brain health. Again, if you know anyone who may be experiencing Alzheimer's, please consider checking out their website as it provides a lot of useful information, such as this PowerPoint presentation. I do want to take some time and talk about dementia and Alzheimer's disease. Dementia is more a umbrella term that encompasses many diseases that impact the brain and or normal brain development. Dementia, as an umbrella condition, also includes Alzheimer's, vascular dementia, Lewy body dementia, mixed dementia, other types of dementia, Parkinson's disease, and frontotemporal dementia. So this slide is showing you that the overarching category for these type of cognitive developmental diseases of the brain um, are broadly grouped under the term called dementia. So dementia, we consider a set of symptoms that have a gradual onset and also causes a decline in cognitive ability, judgment, orientation, function at home, work, and community. Alzheimer's specifically is a type of dementia. The most common cause of dementia in people over age 65 is indeed Alzheimer's disease. So, in helping you understand the difference between a dementia and Alzheimer's, usually if someone has a set of symptoms that have or are reported as being gradual in its onset, also when people report symptoms that include a decline in cognitive ability or a decline in judgment or a decline of orientation and or overall decline in ability of function in key areas of their life. One of the first things providers will consider is that this person has a form or a type of dementia. Just those symptoms alone would usually imply that client is suffering from a form of dementia. They will then need to do more tests and examinations on that particular client to see what type of dementia. It could be Parkinson, it could be mixed dementia, it could be Alzheimer's. After running appropriate tests, they can then make the confirmed diagnosis that the client has Alzheimer's or any type of degenerative disease. But again, the most common experience is dementia in anybody over the age of 65 years old. Continuum of Alzheimer's disease, cognitive function declines over a period of time. That is what this slide is showing you, and over a course of years. And so there's stages that they consider preclinical, the MCI, and as well as dementia. And aging is the key factor. Okay, so as people age, the aging process is more rapid and accelerated. There's a deterioration related to that aging process that occurs over time. And that is the concern specifically with Alzheimer's disease. This slide is showing that there's a preclinical stage related to Alzheimer's, and then a stage where clients experience what they call MCI, which is mild cognitive impairment, and then over time, the dementia starts to, or dementia symptoms tend to show themselves with clients. What we know is that Alzheimer's disease and related dementias are affecting our care systems, whether we know it or not. Alzheimer's disease and related dementias are affecting our care systems. 1 in 3 seniors die with Alzheimer's or another type of dementia, and that's considered a high statistic. Again, 1 in 3 seniors actually succumbing to Alzheimer's disease. This slide shows you the projected number of people age 65 and older in the U.S. population with Alzheimer's disease, and this is from 2010 and projected into 2050. And as you see, the gray area depicts people who have, or the millions of people who have Alzheimer's between age 65 and 74. The purple area shows you the people, the ages between 75 and 84 that suffer, and ages 85 and up in gold. Again, just to let you see how much the Alzheimer's populations is expected to grow over a course of time. And hopefully this graph really does a good job at depicting that projected growth of diagnosis over time. Physical and emotional impact of dementia caregiving is estimated to have resulted in $9.7 billion in healthcare costs in the United States. There are so many factors that go into supporting people as well as families with dementias. It is considered very high stress levels, and this graph is really trying to show you the very high to not high or somewhat high report of caregiver stress and physical stress. So about 59% of respondents in a survey stated that they were experiencing high to very high emotional stress related to caregiving, where 41% said that it was not high to somewhat high. 38% of respondents reported that there was physical stress of caregiving, and that physical stress was high to very high, and 62% said the physical stress of caregiving was not high or somewhat high. And here the graph is just showing you that there's emotional and physical stress related to caregiving for persons who have Alzheimer's. And so a lot of times in Alzheimer's disease, healthcare teams as well as support organizations such as the Alzheimer's Associations, they spend a lot of money just to help caregivers manage and cope with stress. Stress is a huge outlier, and if you think about it, it makes sense as people who are experiencing Alzheimer's tend to deteriorate over many years, and sometimes it can be slow for some and more rapid for others. And so just understanding that cognitive decline can look very differently for each individual, and the strain and the stress that decline occurs and happens, it will increase how each family deals with and copes with that decline. And so it has a biological consequence, a psychological consequence, and a social consequence for families as well as the patients who suffer from dementias in general, and particularly Alzheimer's. This graph shows you the proportion of Alzheimer's and dementia caregivers versus caregivers of other older people by duration of caregiving, with the bar in blue being caregivers of people with Alzheimer's and other dementias, and the green bar showing you caregivers of other older people. And again, just to show you, how long people care for people who have Alzheimer's versus other older people. And as you see, less than a year tends to be the average time that people in generally care for older people, for 34%. That's the highest. So the highest for caregivers people, of older people, tend to be as highest in the less than year category and the occasionally category as compared to Alzheimer's. But for durations that are over a year, the majority of caregivers for older people are those with dementia. And that is what the blue bar is showing at 43% and at 32%. This slide basically says I had 60 minutes to solve a problem. I spent 55 minutes defining it and 5 minutes solving it. That quote is basically saying that, a lot of times researchers and clinicians spend an inordinate amount of time understanding what a disease is and what is involved. And Alzheimer's, as well as other dementias, is no exception. A lot of funding and research went into just understanding Alzheimer's. Over time, we have learned more about the disease, and so now we're able to clearly define it. Once we have an understanding what a disease is, the origin, epidemiology related to a disease, then we can more easily, oftentimes, come up with ways to eradicate it or resolve that issue. There's a strong connection between mental health and physical health. Whenever someone is battling a chronic condition, it is not uncommon for them to deal with either specific conditions related to that disease, other chronic conditions related to that disease. And this slide is showing you the connection or the intersection between dementia, depression, and delirium. For those who may not know, delirium is a separate condition that can have multiple causes. Chronic health conditions such as dementia can cause delirium, but other reasons can also cause delirium, such as intoxication, sleep deprivation, and it really is considered a disturbed state of mind where patients are very unstable cognitively. They can also have fevers related to delirium. But it's also, when you see someone who's experiencing delirium, they may present as restlessness. They may also be incoherent in thought and speech. And so it's an associated symptom that can occur, or a condition that can occur with dementia. It's usually brief compared to, in terms of symptom presentation and manifestation, but it could be severe. And you oftentimes see people experience delirium with dementia. Another common condition that you see often with dementia is depression. But what you will see is that depression tends to oftentimes accompany chronic conditions. And if you think about someone experiencing a chronic condition over a period of time, it then becomes easy to understand how someone can develop symptoms of depression dealing with that chronic condition. And this also applies to family members as well. Not the delirium, but the depression and feeling symptoms of depression. Only 45% of people with Alzheimer's disease or their caregivers report being told of their diagnosis, when more than 90% of people with the 4 common types of cancers have been told of their diagnosis. And so there's a lot of more work need to be done in educating people and providing clear and firm diagnosis early, so that people can prepare. And there's a lot of preparing with Alzheimer's disease. As you can understand, someone's cognitive functioning will be declining over time. All types of cognitive. Cognitive is how you understand, how you process information, how you see the world, how you understand things, is impacted. And so not knowing that you have Alzheimer's, or family members not aware of what they're seeing when their elderly family member is experiencing cognitive declines, can not only be surprising, but it robs them of the opportunity to plan and support for that person diagnosed. And so we need to do a better job of reporting and diagnosing and letting families as well as patients know what they're suffering from and how to help. The key is the early detection and diagnosis. This doesn't just apply to Alzheimer's, though. We need to do a better job of detecting what the symptoms are, what patients are experiencing, and putting that firm diagnosis in place so that we can begin supporting and treating patients as well as families. There are many barriers to diagnosing of Alzheimer's as well as some other dementias, and it's misidentification of the early stages of dementia. And most time that misidentification is that the person is experiencing normal parts of aging. Um, Social skills are often maintained for a while early on in the disease. And so that's another reason why it doesn't raise to the radar of being identified. Oftentimes, the patients themselves or the person themselves may be in denial, as well as the family members when it relates to what it is they are seeing from that loved one in terms of a cognitive decline. There's also many stigmas associated with the diagnosis, as with many other chronic conditions. And there's also a lack of definitive screening and diagnostic testing. And so these are all things that lend to barriers to diagnosis. So there's a reason why the prior slide you saw before said only 45% of people are told or know that their loved one and their family member is experiencing Alzheimer's or dementia or and similar with other dementias. There's also a coexisting or comorbid association with Alzheimer's. And then these are the other conditions that tend to coexist. So that means patients are not just dealing with Alzheimer's and dementias, there are also additional um, health conditions that they have to contend with as well. And so this graph shows you the percentage of people with Alzheimer's disease and who also have other type of dementias I'm sorry, and other type of dimensions who also have coexisting medical condition. So this slide is persons with Alzheimer's disease and dementia, as well as coexisting medical conditions. 30% are diagnosed with coronary heart disease, 29% diabetes. Again, this is with Alzheimer's and dementia, cognitive heart failure, chronic kidney disease, um, chronic obstructive pulmonary disease, stroke, and cancer, and again, the associated percentage related to those other diseases as well. This slide depicts the hospital stays um, with the coexisting medical conditions with and without Alzheimer's disease. And this slide really talks about those 8 domains affected by Alzheimer's. Those 8 domains are memory, concentration, orientation, judgment problem, or problem solving, activities of daily living, mood, and or spirituality. In terms of memory, clients or patients don't oftentimes know where they are, where they're located. Or if you take them, for example, to a doctor's appointment, they won't know where they are or why they're at a doctor's office. Or in a hospital setting, they won't know what it is that's attached to their arm. Concentration, in terms of their ability to be attentive to situations, to perceive and understand situations. And so sometimes people are detected in terms of having some cognitive declines in employment situations. They may present to work and not know what it is they should be doing at work. And they may not even recognize their coworkers at some point, or have a lapse in memory related to a coworker. And that's usually a red flag at work. Something's not right, or there's something wrong with that particular person. Orientation, again, a person may not know where they are located or where they are, and they may not know who their family members are or how to locate them or contact them. Again, there's challenges with judgment and problem solving. Um, they will concern themselves with how to feed their cat, who will feed their cat, as they may forget to feed their cat. They may not understand why they need to stay in their house or at a particular location, such as a nursing home, and when their care becomes too complicated and needs more ongoing round the clock care. They may feel that they don't need to stay there or in a hospital setting if they need inpatient medical treatment. Um, Activities of daily living over time gets complicated where patients are not able to get up anymore um, or be able to walk to the bathroom by themselves unassisted. Their mood again will decline over time, and that's why we talked earlier about depression. Um, they can have other experiences other than sadness. They can feel scared. They can feel pain, physically and or emotionally due to deterioration or decline. Um, spirituality also can be compromised when someone is dealing with Alzheimer's and other dementias. So, for example, they may forget their belief system. They may feel that if you take them to church for support, they could be a member of a church for many, many, many years and feel that the congregation or people in the church don't know who they are. And they may also have this sense of feeling out of control in situations to support their spirituality. This slide talks a little bit about the care and the cost of treating Alzheimer's and dementia patients um, in different levels of care at the medical provider's office, inpatient hospital, skilled nursing facility, nursing home, hospice, home health, or prescription medications. People who are suffering and families who are taking care of people who are suffering from Alzheimer's, they need to be mindful of the associated adverse health events that can occur with Alzheimer's. So, 3 to 6 people are experiencing Alzheimer's are 3 to 6 times more likely to develop delirium, 1.5 to 5 times more likely to fall, 5 times more likely to develop urinary incontinence, 6 times more likely to develop fecal incontinence, and 5 times more likely to develop pressure sores. They're more likely to have untreated pain, 2 to 4 times more likely to lose ability to perform activities of daily livings during a hospital stay, 2 to 4 times more likely to be discharged directly to a nursing home, and 3 to 7 times more likely to be living in a nursing home 3 months after discharge from a hospital. Um, there are also safety concerns related to people dealing with Alzheimer's. 6 to 10 people with Alzheimer's will wander. And that's oftentimes one of the reasons why they are placed in nursing home facilities so that they can get that 24-hour supervision around the clock care when families are no longer able to provide that care. And that's usually to ensure their safety. And they need oftentimes a dementia capable environment. So, an environment capable of managing, monitoring, and supporting individuals dealing with Alzheimer's to help prevent them from falling and helping to provide clear directions to help improve that client's ability to understand as long as possible. The CARE Act requires hospitals to record the name of family caregivers on the medical record of a loved one with Alzheimer's, inform the family caregiver when their loved one is discharged to the patient's residence when they're discharged back home, and to give the family or caregiver education and instructions in all aftercare tasks described in the discharge plan. This is not unique to Alzheimer's, by the way. Oftentimes, healthcare professionals are doing cognitive assessments um, for patients to help them understand and diagnose what's going on with them. And we also have plenty of resources out there, and a lot of them can be found at alzheimers.org to help family members as well as persons affected understand their dementia diagnosis, how to manage it, and toolboxes to help support patients and families. Here are some additional resources that you might want to look up if you want to learn more information. Improving hospital care for persons with dementia, as well as the Alzheimer's Healthcare Handbook, and the Alzheimer's Association Facts and Figures. Care and support is so key, not just for people who are suffering from Alzheimer's, but people who are caring for them. There's a hotline here available as a resource and a helpline for caregivers. If you remember earlier, there's a lot of emotional and physical stress on caregivers. You can receive care consultation, attend support groups that many people do and find very helpful. The lending library to obtain information, additional educational resources related to Alzheimer's, community education, educational outreach, as well as professional training. And other type of meso and macro support for persons persons and families dealing with Alzheimer's included workshops in the community to educate caregivers and family and patients. There are many advocacy efforts always occurring to help support, to gather more research money for Alzheimer's and support family and individuals with Alzheimer's, and also many free educational materials for not just family members, but also staff and patients as well. I hope you enjoyed this brief overview of Alzheimer's. As with all videos, information, this video is meant to complement the information that you're reading in your textbooks and the accompanying websites as well. This is just a brief overview of Alzheimer's and dementias. Please be sure to read all of the information in your textbooks to help support your learning related to Alzheimer's and dementias.